I'd like to talk about some common upper extremity injuries and to help you determine when should you come in to be seen urgently or what conditions could you possibly wait a few days to be seen for. So we'll start with an example of a wrist injury. So let's say you slip and fall, you reach out to try to break your fall, and you suddenly have severe pain to your wrist. If there's no deformity, meaning you can look down at your wrist and everything looks straight and in place, that's typically something that we could do a telehealth visit for to start with. You might need x-rays within a few days, but generally an injury where there's no deformity, we could certainly take a look by phone or by virtual visit and try to treat you that way to start. Another example would be if someone falls and injures their elbow. As long as your elbow appears to be not dislocated and you're able to bend and straighten the elbow reasonably well, even if there's a little bit of pain, generally an elbow injury that's not a dislocation could also be treated within a few days. Again, a telehealth visit would always be appropriate to start. So a few different ways that we could recommend treating a non-urgent upper extremity injury. So whether it's your wrist that you injure, a finger, or even an elbow, a few things that you can do. Some of these might seem common sense, but a few things that you can do to treat that injury before coming in to be seen. Certainly you could ice that part of the body. So we generally recommend elevating that part of the body on a pillow. You could ice for about 15 or 20 minutes at a time. I generally recommend placing something between your skin and the ice, such as a thin towel, just to protect the skin. Other things to do would be a wrist splint. So if you've fallen and hurt your wrist and you chose to purchase a splint online, that would be certainly one option of what you could do. A splint will help to immobilize the injury until you can be seen. I don't generally like to talk about anti-inflammatory use because some patients really shouldn't take anti-inflammatories, so that is something we'd have to discuss more during a regular visit or even a telehealth visit. Other things to be aware of with upper extremity injuries that can be quite common. Even without a fracture, you might notice a lot of bruising or even swelling, even lower than the part of your injury. This can be very common, especially due to gravity. So that's usually not cause for alarm as long as you can still wiggle your fingers, you have normal sensation. If you have worsening pain, excruciating pain, excessive swelling, those are reasons to get a hold of us much sooner. I'd like to talk about some common non-urgent upper extremity injuries. So as a general rule, if you have an injury and you can look down at your wrist or your elbow or your finger and nothing appears to be out of place, generally this is something that could be seen non-urgently. So also as long as you can still put weight through that part of the body, it's less likely that there's a fracture to that region. And if you can wiggle your finger or move your wrist and elbow reasonably without too much pain, also something that might not be an urgent situation. A common overuse injury that we see in elbows, this can be in an athlete or this could be in someone who has never played a sport in their life, would be golfers and tennis elbow. So classic findings of golfer's elbow would be if you have pain to the inner aspect of your elbow. Tennis elbow is when you have pain to the outer aspect of your elbow. Classically, this condition would bother someone when they're moving their elbow, but also with excessive wrist range of motion. So while this is something we commonly can treat in the office, this is also a condition where a telehealth visit would be appropriate for a consultation. Rarely is an x-ray needed for this unless there was an actual injury associated with it. So one way that we can treat a golfer's or tennis elbow is to use a specific type of brace or a band, and that's something I will show you momentarily. Other things that are helpful would be ice or anti-inflammatories if that's something that you are allowed to take. I won't touch too much on anti-inflammatories during this talk because they're not safe for everybody to take. So again, golfers and tennis elbow is a fairly common overuse injury that we see. Can be treated with a telehealth visit initially or an in-person visit.